It's hard to believe that before the Childhood Dementia Initiative was launched 3 years ago, there was virtually no evidence on the collective impact of childhood dementia. Awareness was almost zero. There was no recognition of the gap in services when it came to care and support. There was no research happening on multiple conditions concurrently. And there was no inclusion or acknowledgement of children with dementia in policy. Now, we work across 3 different areas, and I want to give you a bit of an update on each of those areas and some of the progress we made in 2023. First, let's look at research. Now, the long-term goal here is for treatments and cures. Childhood dementia is now on the radar of researchers, and we're at the beginning of a new wave of research that will ultimately lead to treatments and cures. Here in Australia, there are currently 12 different projects underway looking at multiple childhood dementia disorders concurrently, or looking at the relationship between childhood dementia and adult dementia. Now, this collective approach has never been undertaken before, and it's going to be key to accelerating that research towards the treatments and cures that are so desperately needed. In 2023, research was also published in an international esteemed journal, Brain, that outlined the impact, the extent and the magnitude of childhood dementia for the first time. Our head of research was one of the lead authors on that project. Next is care, where our ultimate goal is equitable access to care for families who have a child with dementia. Finally, the voices of families are being heard, and we've seen great progress in 2023. We partnered on a study that looked at the lived experiences of families and their interactions with the care and support services. The findings were actually pretty damning, and the subtitle of that report was actually "We Don't Fit," because that's the consistent message that we received back from families, that they don't fit within the established systems of health, disability and social care, and that they're constantly having to battle for the care and the support that their kids so desperately need. We also worked with researchers at the University of New South Wales to begin to document the psychosocial impacts of childhood dementia on the entire family unit. Now, this research confirmed that families globally are struggling with this, that there are gaps in support, there are gaps in care, and that these families are shouldering this burden themselves, while at the same time grieving the loss of their children. And in 2023, we partnered with Alzheimer's Scotland to enable them to begin extending their services that they currently provide to adults, to children and their families as well. And finally, to advocacy, where our ultimate goal is for childhood dementia to be a health policy priority. Awareness is continuing to grow, policymakers are beginning to understand and respond, and families are uniting to put the needs of our community front and centre. The Scottish Government were the first in the world to release a national dementia policy that included children, and we're looking forward to Australia following suit when the National Dementia Action Plan is released in 2024. Our advocacy program's grown to over 70 actively involved families who generously share their experiences with policymakers, with researchers and with the media to generate the changes that are really needed. We generated unprecedented global media coverage that reached millions of people, and our Face It campaign, which was held on Childhood Dementia Day last year, was the biggest yet. Childhood Dementia Day was even acknowledged in federal parliament here in Australia. As you can see, 2023 was a huge year for us. And although this is just the tip of the iceberg in terms of what needs to change, the momentum that is building makes me really excited to think what might be coming next year and beyond. We're moving towards global sustainable solutions for childhood dementia, and I thank you for your ongoing commitment and support with us as we do this.